Oh, good, you're here for an appointment. What's the time here? Oh, wow, 11 o'clock. Wow, you're here on time. Thank you for being on time today. Okay. And can you verify your name and date of birth? Okay, Walter. Cronkite. Okay. Alright, great. Can I ask what brings you in today? Oh, okay, you got into a fight with a polar bear from Lost. I can definitely see got a lot of blood going on there, especially in your head area and just all over, and I see the swelling, so I'm sorry to hear that. Hopefully we can be of assistance today, and I can give you what I think that you need a cranial nerve exam. Especially since, yeah, the bear swiped at your face quite a few times. I can see you have a lot of interesting things going on there, so let's take care of that. Can I ask you some questions then? Okay, great. On a scale of 1 to 10, what is your pain level? About a 9. About a 9, okay. That's completely understandable. Can I ask you, are you on any special diets right now? Anything that I need to be worried about or that I should pay attention to? Okay. Okay. Well, that's good. I personally would lay off the cream cheese a little bit. I know that it's a very good source of fat and protein, but maybe it's a good time to introduce other things into your diet. Okay. Right, just to get some of those vitamins and minerals like zinc and vitamin C and things that perhaps the cream cheese doesn't have. Okay. All right, great. You take a multivitamin. That's good to know. I was going to ask, are you on any other medications for pain or anything? No? Okay. All right. And any other kind of swelling issues besides I can see your head is swelling quite a lot. But do you have any swelling in other areas that might not have been caused by the polar bear? Okay, none of that. That's good. What about urinating? Was your urination levels pretty good? Okay. And the color of your urine, is a nice light yellow, clear? Good. Okay. And so we have that going for us. Great. Well, I'm going to have you take a seat. I'll be with you in a few minutes, and let's see if we can take care of that mangled head of yours. Okay, good. Okay, so first, what I want to do is just check your overall vitals. So if you could take out your finger, I'm going to go ahead and put this device right on your finger. Okay, what I'm doing right now is I'm checking your oxygenation levels. Okay, yeah, just hold this there. Good job. Okay. Oh, good. It looks like you're oxygenating fairly well, given your condition. So that's really good. I'm very, very pleased to hear that. Okay, so next, I think that we're going to take a listen to your heart, okay? Make sure that your heartbeat is normal. If I need to do any procedures or surgeries today, I think it might be the best option to make sure that you are beating right in your heart. Okay, good. All right, so I'm going to take this. You know what? This is a fairly new clinic, and I left my stethoscope at home, so I'm just going to take my hands. Okay. Make sure they're nice and clean. And I'm going to do this the old-fashioned way and just listen to your heart with my hands. Okay. Your heart's very warm. It's very warm, but I think it's pumping a little fast due to the attack. So sometimes when we lose a lot of blood, like the amount of blood that you've lost so far, your heart's going to want to beat a little faster to try to compensate I'm not surprised that you have a fast heartbeat, but let's take care of that, okay? All right, let's do a quick breathing exercise. So I'm just going to have you breathe in through the nose and hold it for 5 seconds and then out through the mouth, okay? All right, good. So in through the nose. Hold for 5 seconds and out through the mouth. Okay, good. You're still bleeding quite a lot, but I think that now that your heart's a little more relaxed, the bleeding is not going to get too much worse. Maybe a little bit worse, but not too much worse. So that's good. Okay, and what about your blood pressure? All right, I know your blood is under a lot of pressure right now because it's just shooting out of your veins at an uncontrollable rate. But if we just take this strap and just right here, just put it around here, put it around your arm right here. Okay, good job, good job. Okay, putting that around your arm. That's a good rate. So I'm just gonna crank my I'm gonna crank my blood pressure speedometer. Okay, just real quick, just deep breath, and make sure that your blood pressure is okay. Okay, it looks a little high, but you know what? I'm gonna give you a pass on that because you were just attacked by a polar bear. But so we're gonna do some more checks then, and then see if we can get you admitted if we need to. But I think that just with a couple things like tender love and care, you're going to be just fine soon. I think I can fix you up just fine, okay? Yeah, you already seem to be a lot more composed right now, so that's good. All right, let's move on. Okay, so now I want to take a listen to your lungs. So if you could turn around for me, that'd be great. All right, so I'm just going to take this stone and press it against your back and your lower back, and I just want you to breathe in and out, sort of like we did with our breathing relaxation exercise. Yes. So I want you to breathe in and breathe out. And I just want to listen to make sure that your lungs are inflated. Oh yeah, they're inflated. They're definitely working. Yeah. That's good. In and out. Fantastic. Okay, that's wonderful. All right, great. Okay, you can turn back around for me. Thank you. Great. All right. So next, I understand that you have a lot of blood on your head, but I'm still going to ask permission if I can touch it because I'd like to palpate your face. Yeah. So I'm just going to take my finger and I'm just going to palpate. Okay. Just like that. All right, great. Palpating. Palpating. And then percussing. Okay. Wow, that's a lot of, you definitely do have some blood going on there. So I do understand that you're in distress a little bit. But the good news is that the palpation and the percussion went super well. So you're all palpated and percussed right. I didn't feel any thing internally. I did feel a lot of lumps and bumps just from all the gnashing of teeth and the gashing and all that from the polar bear. But I do think that that swelling is going to go down if you do those breathing exercises and just, take the medication, because I will be giving you some medication at the end of this, okay? Is that all right? Okay, that's amazing. Okay, great. Great. Okay, now I know that it's been a heck of a day, but it is important at the beginning and end of every day that we smell things correctly. I don't want you to be mixing up, your smells with your tastes or your colors with your smells, or I don't want you to be smelling French toast when you should be smelling apples, because one of the most important abilities that we have is our sense of smell. So I'm going to put you through a small smelling test. Not spelling, but smelling, okay? We'll do the spelling test later. How about that? Okay. All right, we'll do that after the appointment. We'll do that just for fun. But right now you're going to be smelling and tasting a few things, okay? So just hold on a minute while I prepare that for you. All right, great. Just going to try to wash my hands of some of this blood, though it's still kind of stuck on there, yeah. So, you know, that's what happens, though. Animal attacks can be really rough. Okay, great. So what I want you to do is just take a deep breath and tell me what you smell, okay? I'm going to put this right up to your nose. And you can just tell me what this is, okay? What do you smell? You smell saltine crackers. That's wrong, sorry. Try again. Here. Let me. Mix this up just a little bit for you so you can have another chance to smell that. What do you smell? Oh, honey. Good job. Good, honey. So you got that on the second try. I'm going to go ahead and write that down that you might be having some issues with your smelling. Oh, yeah, bleeding from the head and the concussion. We'll get to that. We'll definitely get to that, and mending up your head and all that. I understand that bleeding from the head can cause you a lot of distress, but right now, let's focus on your sense of smell, okay? Because I think that's something that a lot of times is overlooked after bear attacks, is that we get attacked by a bear and then we don't even think about, can I still smell things correctly? And that's really important. So we just want to kind of nip that in the bud so it doesn't progress into, you smelling, I don't know, like a sewage tunnel and thinking that it smells like Bath and Body Works or something like that, because that would be sometimes our smell can be a defense mechanism. So we don't want you walking into a contaminated sewer and thinking that it smells like apple pie and rosemary. Okay. So I just wrote that down. Okay, was that okay that I wrote that down? Good. Okay, great. Now, are you hungry? Because I'd love to give you a taste test. Okay, good. Okay, so I'm going to blindfold you real quick. So I'm going to take this blindfold and just put it over your face. Okay, good. So now you can't see the food that I'm about to give you. So that'll be really super interesting, I think. Okay, so I have two things that I want to give you. So just first, I'm just going to open this first thing that you're going to taste. Okay, good job. Just relax. Great. So now just open your mouth. Okay. So what is that? It's a mint. Good job. Do you know what flavor the mint is? No, it's not peppermint. It's not wintergreen. It's wintergreen. Wintergreen. It's the Lifesaver brand. So it is wintergreen and not wintergreen, but you're very close. However, that's a tiny cause of concern. So I'm just going to go ahead and write that down, that you might be having some issues with that. Okay. And next, I'm going to just take this. You're correct. That is a raw mushroom. Yeah. I know that it's not cream cheese, but if you swallow it, that's okay, because it does have some of those nutrients that we were talking about earlier. Can you tell me what kind of mushroom it is? That's an oyster mushroom. Great job. Okay, well, that's really reassuring that you were able to identify the type of mushroom. So let's keep going then, okay? I'm going to go ahead and take that blindfold off so you can see me again, because I think that would be helpful. Good job. So just to test the sensations on your face, because of this distress that you might be going through, you need to make sure that you're feeling things correctly and that your senses and your face are all, intact, so that's good. So I'm going to take this pen and hold out your hand for me, please. Okay, so when you feel this pointiness, do you feel that? That's a sharp sensation. And then the other side is going to be more dull, okay? Yeah, that's great. Okay, so close your eyes and I'm just going to run this test on you, okay? Was that sharp or dull? That's good, that's sharp, okay. What about this? That's dull. We'll try that again, okay? What about this? That's dull, okay. Dull again, good, good. How about this? That's sharp right on your forehead. That's sharp too. Great. So it seems that you have a sense of sharp and dull. That's really good. Now I'm just going to test and see where you're feeling these things to make sure that, you're not feeling something in your ear when I'm putting it on your nose. That would be extremely silly, okay? All right. All right, so why don't you tell me where you feel this? Do you feel that in your nose? Okay, good. What about this? You got your chin. Got in your chin. Good job. And then up and up and up here. Oh, that's wonderful. Okay. Okay, a couple more if that's okay. There you go, in the back of your head. Okay. And up here. On the other side of your head. The other side. Good. And then, sorry, I didn't mean to make you flinch. That was your eyelid. Yeah, good. So it seems like you can feel all your sensations in your face. So I'm really happy to hear that. So I think next I'm just going to test your reflexes, okay? This isn't particularly to do with the cranium, but I think it's important because next time you're in a situation with a bear, you want to make sure your reflexes are sharp, and by the looks of it, you did not win the fight with that polar bear. So I want to make sure that maybe next time you get into this situation, you might have better reflexes, and also the fact that you're so mauled in the first place might mean that your reflexes weren't intact, and maybe if you had better reflexes, then you would have been able to fight off the bear. Yeah. I'm not judging you or anything, but that it doesn't look like you won that one. Yeah, okay. Well, it's good that you're alive though, and but let's get those reflexes taken care of, okay? Okay, so I'm just gonna take this and just take out your arm, right? And I'm just gonna smack it against your arm to see what happens. Okay. And when I say see what happens, I know what's supposed to happen, but I don't want to give you any prompts. Alright, so just relax now. You're in my care. Good. Good. Very good. Good job. Good. And now I'm going to go down to your knees. Okay. So I'm just going to hit your knees and make sure that they is a little weak, to be honest, and it didn't react as well as the other knee. So that might be part of the reason why you didn't do so well with that bear attack, is that your left knee maybe was a little slow on the uptake to do your defensive moves. So just keep an eye on that for next time. Good. Okay. Alright, and now I just want to take a look at your eyes, if that's okay. Alright, good. Alright. So I'm just going to peel apart your eye. I'm just going to open it right here. I see your eyes are quite bloodshot. Okay, can you still see me? Kind of. You're slowly losing vision. Okay, alright, well, that could be an issue in the future, but as long as you can kind of see me, let's roll with it now. And I'm going to take this light and disinspect your eye. A lot of blood, a lot of Okay, your veins look particularly stressed and bulging, so we might give you some eye drops for that for sure. And your other eye seems to be very stressed and bulging as well. Your veins in particular, they seem like maybe a couple of them might have burst, or maybe you're just tired from the attack. Either way, just to cover our bases, we're going to set you up with a great eye drop solution. Yeah. So I'm glad that we looked into that, though. I want to check just to make sure that you can see the shapes around you. And how I'm going to do that is I'm going to hold up, fingers, and you can tell me how many I'm holding up, okay? 5, that's good. 2, very good. No. Absolutely not, no. 3, good job, good job. 5. 4, that's very good, okay. 1, okay. And can you tell me which of my fingers I'm holding up? Is this my pinky? That's my pinky, good job. Is this my thumb? It's my thumb, good job. You're doing a good job. Yeah. And so, or do one more. That's my pointer finger or my index finger, if we're going to be technical about it, which I think sometimes it's good to do that. Sometimes I think it's good to be technical. I like to be technical. Okay. So I think that you passed that test. So your eyes are going through a lot of stress, okay? But, so that's good. I'm just going to check one more thing with your eyes, okay? So I have these 2 bloody fingers on both hands, and I want you to let me know when this goes out of your field of vision. Tell me when. Good job. Tell me when. Good job. Good job. Good job. Good job. Good job. I want you to only follow this hand, and actually I'm going to hold up this mint, and I want you to just follow the mint, okay? Just follow the mint. Ignore my other finger. Ignore my other finger. Just follow the mint. Good job. Follow where the mint goes. Worship the mint. Yes. Yes. Follow the mint to the ends of the earth. Good job. All that matters is this mint. Yes, you just got beaten quite badly by a animal that weighs over 1 ton, but what you need to think about right now is this mint, and then it's going up and down and maybe side to side. Good job. Alright, so you passed that mint test that I just kind of put together for you. Okay, and now I'm just going to give you a quick hair check to make sure that you don't have any lice or any kind of animals in your hair, okay? Because polar bears are known to have parasites. And if a parasite jumped from the polar bear into your head during the attack, we want to make sure that we're taking care of that and that we're aware of that. And if the parasite that's living on your head needs its own cranial nerve exam, we can definitely do that and give your little parasite its own checkup to make sure that that parasite is healthy and everything is intact with that parasite. And that we can make sure that the parasite knows how to smell and taste things well, okay? Okay. So, why don't you just let me see your hair? Okay, good. Peeling apart your hair. Very nice. I see you have very good follicles. Okay, I love your follicles. I hope that's not too forward in saying so. I see that there's a lot of blood caked on here, so it's hard to tell. I don't see any parasites though. I do not. Okay, so your hair is parasite free. I don't see any bot flies or any kind of lice. That's wonderful. However, if you do notice something moving on your head or some kind of like little bug or animal, why don't you go ahead and give me a call, okay? Give me a call and tell me about going to go ahead and make a little report for you now that you're done. And about your head. Yeah. So I think what you need to do is just wash that blood off, because you're gonna kind of freak people out, on the street. So there's a bathroom on your way out, so you can just go to the bathroom and wipe that blood off your face. I'm gonna go ahead and set you up with some Tylenol. Okay. I'm gonna give you some Tylenol, and we're gonna put you on a high fiber diet. Okay, so I'm gonna write down some instructions for that. Plenty of mushrooms and bran flakes and things like that are gonna be great for you and your healing from your polar bear attack. Okay. And then one thing that I'm gonna ask you to do, just in the next week or so, is to not have any confrontations with polar bears or any bears, okay? So if you could not get in a fight with a polar bear just in the next week or so, give your body some time to heal. So in a couple weeks, whenever you do feel like getting back in the ring and really engaging with that polar bear, that you are healthy and that everything is intact and all your vitals are there and that your reflexes are strong, so you can go ahead and give that polar bear what for, and maybe you can win the next fight. Okay. All right. Yeah. And I think that if you win the next fight with the polar bear a couple weeks from now, that'd be really attractive to me, and you can give me a call and maybe we could go out on a date, but only after you beat that polar bear's butt. Okay, good. Yeah, no, I am a professional doctor, for sure. Yeah, this is my clinic. Oh yeah, I'm such a doctor. Yeah. So, yeah, do you have any other questions? No? Okay. Well, that's great. So we're going to go ahead and check you out, and I'll give a follow-up call in the next couple weeks and to see how it's all going. So thank you so much for